This one's for the ladies. You know, in women, heart attacks are often misdiagnosed, overlooked, or sometimes just brushed off. And that's why so many women don't get the help that they need until it's too late. So if you're a woman and you're 40 and above, stay to the end of this video and we'll talk about some of the symptoms that you should keep an eye out for. Hi, my name is Dr. Hack and I'm a board certified cardiologist and a social media medical influencer who uses his platform to teach people heart healthy information. I've had the beautiful opportunity of taking care of so many women who've had heart attacks that began with mild symptoms. On July 1st, 2019, this was my very first day of my cardiology fellowship. I had just finished the morning of orientation and now I was heading into the hospital to see patients on our consult service. I got a call from one of the hospitalists that one of the patients that they had admitted needed to be seen by the cardiology service. We get to the room, there's a 70-year-old woman who was in the bed and she's looking mildly uncomfortable. Not because she's in pain, but because she's not used to being in hospitals. After talking to her, she told me she came to the hospital because she had been swimming avidly her whole life. But in the last week, she had experienced arm pain while swimming. Now this alarmed her because this was not something she had ever experienced before. Initially, the pain began and ended quickly. After about a week, she noticed that the pain was lasting longer. Now, when I talked to her more, she denies any chest pain, any shortness of breath. She was still able to complete her laps without slowing down. In her mind, she thought that it was musculoskeletal, which is a good thought. Now, we did some labs, we did some imaging, and we saw that on her EKG, she had some changes in her pattern that were not present on an EKG she had had prior. Also, her echocardiogram showed that a part of her walls were not moving correctly. There may be something impending going on that just hadn't really manifested itself yet. We sent her to the cath lab and we found that she had severe artery blockages in all three of her major vessels. We then sent her to our cardiac surgeons where she eventually underwent coronary artery bypass grafting or bypass surgery. And this is when the surgeons create detours for blood to get to the heart muscle when the native arteries are blocked. That experience and many others like it show me just how different heart disease looks in women. And that's why I'm here, because I want to make sure stories like hers don't go unnoticed. Now, here are a few things that every woman should know about heart disease. Heart disease remains the #1 killer of women in the United States. Secondly, estrogen has been found to be protective against heart disease. So as estrogen levels decrease, particularly after menopause, the risk of heart disease goes up. Thirdly, Hispanic and Black women face disproportionate rates of heart attacks and heart disease in comparison to other racial groups. And lastly, symptoms in women are different. Now, the symptoms are sneaky. Symptoms can be confusing, not obvious, even for providers. But I want you to think fatigue, nausea, abdominal pain, shortness of breath, pain in your jaw, neck, back, even dizziness or headaches. How do we prevent this? Now, I want you to write this down and take some notes. The next time you go to your doctor, I want you to ask for these 4 tests, which I think give a great overview of your overall heart health if you don't have any symptoms. That's an EKG, a lipid panel, a lipoprotein A, and a calcium score. Now, women, this other part is up to you. It's the lifestyle changes. So that's our diet, decreasing cholesterol, sodium, and bad fats, while increasing vegetables, fruits, lean protein, whole grains. Exercising, 30 minutes a day, 5 times a week of at least moderate intensity activity. And if you're smoking or drinking or doing illicit drugs, stop. So just like my patient who had arm pain while swimming, you know your body, trust your gut. If something feels off, get tested. If you need to get a second opinion, don't feel bad about it. So now that we are aware of the less concerning signs that can happen in women that could be a heart attack or an impending heart attack, I want you to share this video with the woman that you love. And if you want 7 healthy foods that you can incorporate into your diet to decrease the risk of heart attacks, click this link and watch this video. Like, subscribe, and comment, and until next time.